Okay, hi, my name is Dr. Laraj Sundar. Welcome back to this week's topic here at Sajo Colonial Clinic. So today I'll talk about causes of wrist pain. I already talked about the carpal tunnel syndrome in another segment. So today I'll go over just other causes of wrist pain, and for the few specific conditions, I'll do a separate topic on that for next time. So the wrist joint is made up of 8 small bones, and there's a lot of tendons and ligaments that attach to it. So for the most part, the most common cause of wrist pain usually is when someone falls. Our first instinct is to do this, to kind of protect ourselves. So a lot of the times when people come in and they have a bad fall, this is most common cause of a wrist fracture or a sprain. So that's usually the #1 cause of wrist pain. There's other causes as well. If you have pain on the base of the thumb, so you're getting pain like in here with these kind of movements, that could be due to a condition called de Quervain's tenosynovitis. So that's a separate topic I'll talk about next time, but that can be a cause of a pain at the base of the thumb. Another one could be arthritis. It's not that common in the wrist, but it is if you have multiple injuries to the wrist. So that could be another reason why you're getting pain in the wrist. Rheumatoid arthritis is another one. That usually affects both wrists, not just one. Then there's also, you can get ganglion cysts. So these are like fluid sacs that kind of swell up. That's another one. And then you can get, I believe there's a Kienbock's disease, which is just a decreased blood supply to one of the bones. So there is quite a few different things. Of course, stress fractures can be another one. And it's important to get it checked out if you have any concerns about that. So for the most part, if a fracture is suspected by your doctor or chiropractor, the first thing they'll do is to order an X-ray or CT scan, and usually between the week or 10 days is usually the time that they'll do it. If that's okay, then you're reduced down to either a sprain or a tear in the ligament, or it could be something else. For the most part, if it's simple sprain or strain, rehabilitation, physical therapy, chiropractic, massage, homeopathy will be the best treatment avenues to take to help with that. Homeopathy is great because it helps to heal the damaged tissue. Acupuncture is great as well because if a nerve is affected, of course, it can help target that specific area and help start the healing process for that. And then chiropractic, again, can help to rehabilitate the muscles and get the strength back up. So I'll go over. Again, there's going to be, it's similar to the other topics, but the one exercise that will help again with the weights, right, in the wrist. So we'll do this again. So you're going to do a lot of wrist flexion, extension. If there's a fracture, you have to kind of ease into this, but just increasing the weight on whatever object you're holding, even a dumbbell, you can start doing these. And then this as well. And then the other one that's a little bit different is basically we're going to just do wrist rolls. So this helps just to kind of loosen up the area. So you're going to do a lot of these in the beginning. And then again, wrist stretching, of course, is always good. So this, you guys have probably seen this about 10 times now, but it does help because it stretches out the whole forearm. So those are the 3 exercises. And then the other exercises will depend on what the diagnosis is. So the main 3 I'll just talk about, I just did. And then the acupressure points. First one, same thing, you're gonna hold for about 15 seconds and you can do it about 2 or 3 times a day. And it's on the base of the thumb, like right in the wrist here. So you wanna hold it and then you'll feel a little bit of pressure. And then just release after 15 seconds. So that's the first one. And then the other one is the same one, this one again, between the thumb and the second finger. This is good for basically any conditions of the wrist, fingers, elbow, any forearm problem. So you'll see me do a lot of this. But this is a great acupressure point for everything in the forearm and wrist. So that's the acupressure points. So that concludes our segment for today, and I'll see you guys again here next week. Thanks.